Hi guys, I'm back. Is that creepy enough? So anyways, in my last video I mentioned feeding tubes, and these are wonderful because you don't have to worry about your patient not being able to swallow pills. All you do is like crush them up, and this can be done by stepping on them really hard, like actually we do have pill crushers. So you crush them up, add a little water, and presto, you flush them in the tube. It's so easy. And here's a little tip: before you go in all excited about giving those morning meds, you want to check the residual, which is checking to see how much content is in the patient's stomach. We want to make sure they're digesting well so we won't have any vomiting issues. So here's the demo. This is my tube, G-tube. This is the syringe. So we're going to connect it together, pull back on the syringe, and see how much content fills up into the syringe. Man, I really need some real supplies, don't I? So, embarrassing nursing story time. I had this patient with a G-tube, and I gave him his meds, and I was feeling all good, you know, because I was learning this new task and everything. And when I went to flush his tube with water, I popped the cap off, and all the meds and GI contents came spilling out onto the bed. It wasn't pretty. I was mortified. Like, he was just sitting there staring at me like something was hanging out of my nose. Hope not. I always wonder what he was thinking, but maybe I don't want to know. So, nursing school tip. This is your tube. And a lot of times there will be a clamp on the tube, or sometimes it'll have a stopcock that you can turn, which stops the flow of contents through the tube. Or you're gonna just have to clamp it like this. So make sure you do that, otherwise you're gonna have a situation like I did. Okay, next we have colostomies, and this is just an alternate way of going number 2. All I really have to say about this is make sure that you empty the contents and the air in the bag before the bag pops off and causes a mess that you really don't want. Okay guys, moving on, we're moving on. So, is your patient urinating okay? Do they have a Foley? What's the color and consistency of the urine? Is it smelly and singeing your nose hairs? How much should a patient be urinating? Well, they should be urinating about 30 cc's per hour, which is like 240 cc's in an 8-hour shift. But what if your patient's incontinent or they haven't urinated all shift? Well, chart how many times they're incontinent during the shift, and if they haven't urinated, you can always do a bladder scan to check how much urine is just sitting in their bladder. Then you notify the doctor because they might be retaining urine and need a Foley catheter. Well guys, that's it for the GI segment of the head to toe assessment. I'll talk to you soon, okay? Bye!